The goal of treating trauma patients is to treat life-threatening conditions first. During the initial assessment, the ABC approach is meant to treat any condition that is an immediate threat to a patient's life. When these conditions have been addressed, the secondary survey is performed. The secondary survey is a thorough head-to-toe exam, noting any signs of trauma. The goal is to identify all injuries sustained by the patient. Many factors can cause injuries to be missed, including, but not limited to, a patient's mental status, such as a head injury or chemical in the system, distracting injuries, internal injuries without symptoms. Due to these factors, the best practice in trauma care is to perform a tertiary exam after the initial acute phase is over. The tertiary exam is a repeat of the initial trauma evaluation. It consists of looking and palpating the entire body from head to toe. It is best if this can be done in the first 24 hours after admission to the hospital. A tertiary exam can and should be performed on an unconscious or altered patient, but it would not be considered adequate. To perform an adequate tertiary exam requires active participation from the patient. The point is that the patient can identify areas that hurt, both areas that have been hurting since the event and also new areas of pain that they had not yet noticed. If the tertiary exam is performed on an unconscious or altered patient, the exam should be repeated as soon as the patient is in a condition to participate in the exam fully. This is a demonstration of the tertiary exam. Before I've come in to examine the patient, I've already reviewed all of the x-rays, CT scans, the list of patient's injuries, and I've reviewed the physical exam from the primary survey to be able to compare this exam to that exam. If the patient is not completely conscious and participating, the exam should be completed, but recognizing that it's not an adequate exam, and in order to obtain an adequate exam, the patient needs to participate. The point being that they can identify areas of pain that they didn't notice before. Trent, do you have any pain in your face?
No.
When I push on it, it feels okay?
Mm-hmm.
When you put your teeth together, do they fit together normally?
Yes.
I'm looking at the scalp and examining the face for any bruises or wounds that may have not been recognized before, and I do not see any. I'm going to push on your collarbones here. Does that hurt at all?
No.
I'm going to push on your neck. Do you have any pain in your neck?
No.
When you move your neck, does it hurt?
No.
I'm going to push on your shoulders. Do you have any pain in your shoulder joints?
No.
I'm going to push on your chest. Does that hurt?
No.
And in your rib cage, any pain?
No.
I'm going to push on your elbow and your wrist and your hand. Any pain with that?
No.
Can you squeeze my fingers really tight? Good. The same thing on the other side. Does your elbow, wrist, or hand hurt?
No.
Give me a good tight squeeze. Good. I'm going to push on your belly. Does that hurt at all?
No.
No pain? I'm going to push on your hips. You hurt in your hips?
No.
Trent, I'm going to take a listen to your breath sounds. Will you take a deep breath for me? Again. Thank you. The external genitalia should be examined if there's a high suspicion for an injury. If it was completed in the primary survey and documented, it could be deferred here. Trent, I'm going to roll you up on your side and check your back. As I push down your spine, you let me know if you have any pain. Does it hurt here? No. No pain along the entire spine? No. Very good. Go ahead and roll back. I'm going to push on your thighs. Do you have any pain in your thighs?
No.
How about in your knees?
No.
Pushing on the fibular heads, this is a particular area that's a common missed injury. No pain here, Trent?
No.
Ankles?
No.
Feet? No pain. When I touch you, is it normal?
Yes.
On both sides?
Yes.
Push tight against my hands, up towards your... Good. Very good. With the tertiary exam now completed, I'm ready to document this in the patient's chart. Once the tertiary exam has been completed, the findings must be documented. The tertiary exam can easily be incorporated into a daily note on the day it is completed, or it can be documented as a separate note. When titling the note, it should include a tertiary exam. Example, daily progress note with the tertiary exam, or discharge summary with tertiary exam. The components of the tertiary exam that should be in the documentation includes adequacy of the exam, the complete head-to-toe assessment, spine clearance or known injuries, new findings or symptoms of pain or trauma, and finally, additional exams ordered with the findings of new pain or symptoms. In iCentra, there is a template available for this documentation. By typing .r TERT, this template will be placed in your note. To complete the note, the exam should also be documented. .r EXAMLONG will also produce a template in iCentra for documenting the exam.